For anyone recovering from spinal fusion surgery or navigating their senior years at home, the bathroom poses a massive daily hurdle. The physical act of using a standard toilet often becomes the deciding factor between maintaining personal independence and requiring a full-time caregiver. The standard medical equipment market usually tries to solve this with cheap, temporary risers. Those rely on plastic friction clamps that inevitably loosen over time, creating a severe wobbling effect and a high risk of falling when the user is most vulnerable. The Bemis Independence Assurance bundle offers a $183 alternative. It packages a raised seat, support arms, and a bidet into a single unit, promising commercial-grade stability that looks like a normal household fixture. We are bypassing the marketing material to test this specific model.
We need to know if that premium price tag actually delivers reliable safety for high-risk patients, or if it performs like just another flimsy medical device. The manufacturer makes 5 specific claims we need to verify: a 1,000-pound weight capacity, a patented stay-tight fastening system, solid weight-bearing arms, an integrated bidet, and a proprietary clean shield underside geometry. This flowchart maps out the typical options. You can bolt together a cheap riser, buy a budget bidet attachment, and drill handles directly into your drywall. However, that piecemeal approach usually ends up causing daily friction and maintenance headaches for caregivers. Our evaluation criteria focus squarely on biomechanics. We are testing how this hardware handles the uneven, asymmetrical ways recovering patients actually sit and stand when they are in pain. We are ignoring bathroom aesthetics entirely. Evaluating this seat comes down to a practical ROI calculation on preventing a bathroom fall and avoiding a hospital readmission. Standard risers grip the rim of the bowl with plastic tension knobs. The Bemis system abandons that completely, using a commercial bolting system that anchors directly through the porcelain mounting holes. Post-op patients rarely stand up perfectly straight. They naturally lean their entire body weight to their stronger side. When we tested that heavy, asymmetrical push against one armrest, the unified seat construction and rubber bumpers kept the unit completely locked in place. The hardware achieves absolute rigidity under normal daily use. The 1,000-pound weight capacity serves as a structural benchmark for that stability, proving it can handle repetitive, heavy impact over time. There is a specific installation limitation to note. If you have a vintage, pre-1950s toilet with a thick porcelain base, the included mounting studs might lack the required thread length to secure the nuts. As long as your toilet base meets standard modern dimensions, the bolting system delivers a zero-wobble seat that you never have to adjust. The unit provides a 3-inch elevation, paired with arms rated to bear 350 pounds each, set across a 21-inch span. This animation shows the distinct biomechanical advantage of that elevation. Dropping onto a standard 15-inch toilet forces a sharp, unforgiving angle at the hip and knee joints.
Raising the seat by 3 inches straightens that angle, significantly reducing the strain on the lower body. The handle placement also corrects a major ergonomic flaw. Pushing down from this specific height relies on your triceps and core. That upward push is inherently safer for weak shoulders than reaching overhead to pull your weight up on a wall-mounted grab bar. Because the 21-inch width of those arms is fixed, caregivers do need to measure their space to ensure the bathroom has adequate lateral clearance around the toilet bowl. Combining the targeted elevation with rigid arm support turns the dangerous, shaky drop of sitting down into a fully supported, manageable motion. The integrated non-electric bidet operates entirely off the main waterline. In a recovery setting, this functions strictly as a critical medical tool rather than a luxury add-on. The simple act of twisting the torso to reach backward after a spinal fusion risks immediate structural re-injury. For seniors aging in place, struggling to reach properly often results in severe urinary tract infections that lead to hospital stays. Most budget bidets use plastic fittings that crack under pressure. Bemis relies on a corrosion-resistant solid brass T-valve and a braided metal supply hose for long-term durability. The side-mounted twist handle offers genuine precision. You can smoothly dial the flow up or down, avoiding the sudden, jarring pressure spikes common in cheaper models. This setup does require a specific comfort trade-off. Because it draws from the existing supply line, the bidet delivers ambient temperature water. During winter months, that unheated water provides a severe shock.
Provided the user has the physical tolerance for cold water, the bidet integration safely automates one of the most difficult hygiene tasks in home recovery. Bemis includes a feature on the underside of the seat called the Clean Shield Reverse Funnel. This diagram highlights the daily reality of standard risers. They rely on a hollow, open gap underneath the seat that catches waste and creates an ongoing splashback problem. The Clean Shield geometry fixes this by directing everything smoothly downward into the bowl. The solid underside does create a larger overall surface area. You will find yourself wiping the unit down slightly more often, but the flat, accessible plastic makes the actual cleaning process much faster. This single design choice eliminates the trapped odors and nusses that plague temporary medical risers, offering a massive daily relief for caregivers. The $183 upfront cost provides immediate financial returns the instant it prevents a single post-op fall or keeps an aging parent out of the emergency room for a UTI. This scorecard maps out exactly who should buy this. The ideal sit is a post-surgery patient recovering from a lumbar, hip, or knee procedure who cannot risk twisting, or a senior requiring a dignified, permanent solution to age in place safely. You should pass on this model if your home features a pre-1950s toilet with a thick porcelain base, or if an electrically heated bidet is a strict requirement for your comfort. The Bemis Assurance operates as a heavily engineered stability tool that reliably restores bathroom independence.